Hello, my name is Leslie Connolly, and this is Amie Case, and today we are going to be talking about the Principlist paradigm. So this article was written by Autumn Feister, and some of the main concepts she talks about is why she argues that this is not a good technique for clinicians because there could be many false negatives of trying to put one person's moral issue into one of the four categories. She believes that every situation is unique and there could be different circumstances for the different patients, and that it's too narrow of a moral lens to look through as a medical professional. So she argues that this should not be taught to students who are looking for education in the medical professional field.
So along with that, the principlist part again is kind of talking about how there's four different types of lenses, and um, basically it goes about saying that there's like a metal detector and the archaeology metaphor, and the principlist part again is more functional and useful than the principlism. So the archaeology metaphor is basically saying that there's a wider variety than just these four lenses that could be seen as the metal detector, because metal detectors kind of go through and it's a one-way street. So that would be like the four lenses. It's a one-way street. These are the four. Whereas archaeology metaphor is talking more about how there's multiple different lenses. And again, you can't just have a person fit into every single one. They're going to be spread out. So she talks about how the archaeology is better because as you go on reading, every different case and client is going to be different. Even if they have the same case, it's kind of like different personalities that won't fit under one lens. So she believes that the principlist part again is not is better because it's not going to be categorized under one of the four principles.
I totally agree with you, Amie. And a situation that she actually brought up in the article was the situation of euthanasia, how it doesn't coincide with non-maleficence, which is one of the four ethical categories that was brought up in the article. And the author brought out a really good point of how this is why she argues that the principlist paradigm does not work and how it shouldn't be taught to future students. And I totally agree with her after reading the article because there are a lot of problems with this. So it's kind of frightening that they're teaching these to students because there's so many different circumstances and situations where you can't just categorize one ethical dilemma into one of these four categories and just overlook any other outside circumstance. So I find that crazy how it is being taught, but I'm really glad that there are people like Autumn who are writing these articles and spreading awareness about how we need to look on the outside of the situation and not just the focused lens on the main potential interferences with morality.
I agree with you. And kind of summarizing all that up again, too, one of the other things that she mentions is the role of communication and how it's super duper important to figure out basically what is an ethical dilemma versus what is going to be like a moral dilemma, and kind of making sure that people are providing proper communication too, because without that, you're not going to really be able to express what lens or what viewpoint is going to be more beneficial, or even if you don't and you go away from the lens, like what is going to be the best outcome for the patient. And one of the only ways that you can really do that is by having proper communication between clinicians and the patients who are, ultimately in charge of their own care.
I totally agree, Amie. Thank you for watching our response discussion.